After the patient has been prepared with the polishing, we'll retract the cheeks. I recommend the FlexiBond retractors, which actually give you enough retraction so you can approach the second bicuspids directly without having to come on an angle. Open up a tiny bit for me, and again close a tiny bit for me now. Thank you. Now I need you to leave your head for me so I can wrap up this strap behind you. Close a little bit and just relax your cheeks. Thank you. Beautiful. Now I have beautiful access. Turn away from me. So when I come into the second bicuspids, I have direct access to the bicuspid rather than coming in an angle and having more difficulty placing the bracket. I always use 2 saliva ejectors. Open up for me and bite down in here. And having the patient bite on the saliva ejector allows me to have just the right amount of opening that I need. I'm going to put this cotton under your lip. Thank you, sweetie. And keeps the mouth dry at all times. So we're going to bond the upper arch, and then I'll show you how I prepare the lower and what I do to keep it dry. So first thing we do is we're going to put some etching. So I like to apply etching gel on the teeth rather than the liquid, because with the etching gel, when I rinse, I can clearly see that all the etch gel, it's washed and I don't have a question. Also, it gives me a little more control where I'm placing the gel. You don't need to etch the whole tooth, just the area where the bracket is going to go. So just a little bit of etch on each tooth. The standard phosphoric acid etch. And once we have all the teeth treated, then we just give it 20 seconds for the etching to take effect. And then we rinse and thoroughly dry. Now we're gonna just to the high volume to maintain things dry. I just come close to the teeth. That way the whole mouth, not even my cotton rolls, get wet. By putting the saliva or the high volume suction right next to the teeth and pointing the water stream to the high volume, you don't have to be changing cotton rolls. They never get wet by doing it this way. And then it is important that your 3-way syringe really blows only dry air. There's a little bit of etching here, so that's why I use the gel rather than the liquid. And then with a 3-way syringe that is just blowing air, we dry the teeth. And from this moment on, we do not touch the teeth. You okay? Mm-hmm. So the next step will be to place the bonding agent. On the teeth. And we will apply a very thin layer of bonding agent on the teeth. Make sure that you don't apply a thick layer. So you want to have a very thin layer of bonding agent. So I dip my brush, and this carries a big drop of it. So I take the excess right on the plate where I'm grabbing my bonding agent, and I paint a very light coat of bonding agent. As you can see, I painted 2.5 teeth with just a tiny bit of bonding agent. Now we can start the bonding process. All the brackets must also be prepared with a very thin layer of bonding agent before the cement is applied to the brackets. So now the teeth have not been touched, and as you bond, please avoid touching the teeth, as your gloves will contaminate the tooth surface and you're not going to be able to bond. So your assistant is supposed to pass you the brackets as you go along. You place the bracket, and once it's set, you just hand back the instrument and ask for the next bracket, and you go that way. So I place the bracket using my bracket holder, and then I just change to the side of the gauge and make sure that the bracket is in the right angulation and at the right height. I use a sickle to remove any excess cement that I may have. Quick confirmation of my height and placement. Next. For a change, I don't get a million. I go to the next tooth. The canine has a different height, and that's why I use the IP bracket delivery system. So right here I'm checking my height, and at the same time I'm making sure that I have the bracket in the right position and angulation, followed by a quick clean of the excess cement. And then next bracket, please. The lateral also has a different height, so this will be 3.5 millimeters. And as I place the gauge, I make sure that I have the right angulation of the tooth, parallel to the long axis of the tooth, and parallel to the incisal edge. A quick clean of the excess cement. Next, please. You don't want to use light pure cement on ceramic brackets, because the bonding strength of a light pure cement is too high, and bonding ceramics with a light pure cement will be the equivalent of bonding a veneer. So right here we're just using a soft pure cement. That's why you don't see curing lights. Next, please. But this cement allows you enough working time to set up the bracket exactly where you want it, make adjustments as needed, and even come around and clean the excess cement. Notice that even though I'm using both hands, I am, come towards me a tiny bit, I am not using my finger support on any of the teeth that have been prepared. Touching the tooth with my glove will contaminate my bonding area, and I guarantee debonding. Also make sure that your assistant does not put too much cement on the bracket, or you would have tremendous amount of cleanup to do. The more you have to clean, the more are the chances that your bracket will move and it will end up in the wrong position. Something that's very important, and I don't know if you guys have noticed, I put quite a bit of pressure with the bracket, on the bracket against the tooth, to really get as intimate a contact as I can, so the bracket does not move and I really get the right amount, the right prescription. If you have too thick a cement, first of all, your bracket will move all over the place, and you will have a very thick band of cement that will change your torque of your bracket. So make sure you put firm pressure with your placement instrument against the tooth. So the bracket doesn't slide everywhere. Open up a tiny bit for me, dear. And let's change this so I have a good direct access to your other bicuspid. And last bracket come towards me, dear, a tiny bit. Okay. You see me standing up, and the reason why I stand up, as I work on the left hand, I want to have direct vision to the tooth. And if I'm sitting down, even if the patient is turning her face towards me, I might end up with an incorrect bracket position, incorrect height, and will end up develop an ugly hand that will require either a lot of wire bending or me repositioning all the brackets after alignment. At this time, the upper arch has been fully bonded. Those colors on the bracket will go away as I wash the teeth. And now I just proceed directly to prepare the lower. For video purposes, I chose to do the upper and the lower arch in 2 stages. Typically, in the office, we do both arches at the same time. For the lingual side, what I do is I just put 2 2x2s together. I make a little roll. Then I ask the patient to lift your tongue, please. Open up a tiny bit. And then I just put the cotton, the 2x2s under her tongue, and that will keep the saliva flowing from the sublingual glands in check. And the preparation of the teeth is exactly the same as with the upper. Put some edge on each tooth. And notice that I'm not bathing the teeth on acid edge. I'm just putting a little drop of acid edge in the area near where the bracket, in the area where the bracket is going to go. I don't want the whole tooth edge, it's not necessary. And once the edge is done, which one? Okay. Once we're done etching, again, we count about 20 seconds for the, let me put a little more on this quite costly, for the edge, the acid edge to etch the enamel. And then again, we'll follow the same procedure. And again, I put the suction right on the tooth. The other one is on. Right on the tooth. So I don't have all the water making my cotton rolls all wet and then have to change cotton rolls and so on. Now keep in mind that this process is done by the assistant, and once the patient is ready with all the teeth prepared, etched, and with the initial coating of bonding agent, then it's when you come to the chair just to cement your brackets. So I have a little action there. Now I just put my suction over the gauze, and the gauze is dry. And we make sure that the teeth are dry. I want to see that frosty look on all the teeth.